Welcome back. You're still watching NTV Weekend Edition. Thank you for staying with us. If you're just joining us, I am Sandra Twinovideo and Maureen Nambadirwa on the sign language. Well, one of the most recurrent questions asked by Ugandans as the country battles COVID-19 is on the issue of contact tracing. How do we track those who have come in contact with those who are positive and also those down the line? You may be asking the same question as well tonight, and that is why we have Dr. Henry Mwebesa, who is the Director General of Health Services in the Ministry of Health. Welcome to Talk of the Nation tonight.
Thank you, Sandra. Good evening, viewers.
Well, first and foremost, we do want to thank the Ministry of Health for the good work they are doing for the country in the fight against COVID-19. And my very first question to you is for you to give us an overview of how we are doing in light with fighting COVID-19.
Thank you, Sandra. First of all, I want to thank you, NTV, for giving us this opportunity, and other media houses, because you have really given us opportunity to express a lot about this condition. I can say we are doing very well. First of all, we are able to trace most of the contacts. We have been able to limit all the cases. We now have 55 cases in the country. Early this month, or late last month, WHO had estimated that by the end of this month, we would have about 18,000 cases. When I see we have 55, I feel very proud, and I thank all of us. I cannot thumb my chest, but I still feel grateful that God has brought us this far, and we are keeping the numbers very low. So I really think we are doing well. With COVID, you can't predict what will happen tomorrow, but as of now, we can say we are doing well.
Well, now that we talk of doing well, one particular word has been used a lot, or phrase, contact tracing, and majority of the people may be wondering what exactly is a contact tracing.
When we talk about contact tracing, we are really meaning when we have a positive case. You know, once you have a positive case, then you go and has been in the community, then he gets in contact with very many other people. So when we get such a positive case, we are interested in knowing this positive case during that period, who was he in contact with? And in that case, we therefore follow up whoever was able to get in contact with this person, at least during that time when he was sick. So in the process, we follow up all the leads where this person went. Let's say if we got that person from Hoima, like we had a case there, then we have to go and look at all the people interacted with in his family, certain role members in his family are contacts, then where he was working, where he would go for shopping. So you find it's a long chain. That's how you find that you can have one person. Take, for example, the first index case. Within 2 days, we had already over 150 cases who had interacted with that person. So those are the contacts we are talking about. And we make sure that we find out whoever was in contact with that positive case, we'll enlist him, we record him, and we follow him or her up all the time on a daily basis, at least for 14 days.
So how effective has contact tracing been in the fight of COVID-19 in the country?
I believe it has been very effective because, first of all, as I've said, with 55, we have 1,397, I think, around their contacts. We have followed 1,078. We have followed all of them, and 1,078 have already completed. We have gone through them with them for 2 weeks, and most of them have not been positive. So it has been very helpful. We still have about 318 to follow up, and we are still following up. And we follow them up every day because we have epidemiologists who have to go wherever these people went. So we have to follow them up every day, every day. You check on their temperature, you check if they have any symptoms, you ask them if they have any problems. In the event that they develop some suspicious symptoms, then you have to take their swab and confirm whether they are positive or not.
Just to get something straight, you just said we have about, right now you're following about 318 contacts,
yes.
Is it? Now there's an issue that has been coming up to do with the truck drivers that are coming into the country, cargo drivers coming into and out of the country. What strategies do you have in place because these are people that interact with different people when they come to the country, what strategies do you have in place to ensure that just in case someone is confirmed positive, you can actually follow them up. These are people that could be coming from other countries.
Yes, we get those cases who come in. Let's say we test, let's say we have tested 600
Yes.
and 2 turn positive. Then we have to follow them the routes where they passed, where they stopped, where they had lunch, where they slept, who they interacted with. So we have a mechanism of following them up, and we are working very closely with the Uganda Revenue Authority, with the police and immigration. So we have that kind of collaboration, and we are able to track wherever went, wherever each person went. And that's how we have managed to get the 2 cases one who came from Kenya and the one who came from Tanzania, but even our own Ugandan who was got somewhere in Konakamudi. So we have that mechanism. But we have also realized that we need to strengthen that system, because you don't want them to keep going and then contaminating people, and then you say we have a system of following. So we are trying to develop a system of preventing that to happen, in which case we shall allocate where these truck drivers will be stopping, where they'll be eating, and where they'll be moving to. So it's not business as usual, like you'd come sleep in Naruwerere, from there you come and sleep in Iganga, you continue to sleep in Lukaya. I think that one is stopping now. We are working out mechanisms together with Uganda Revenue Authority and the police to make sure that they have designated places where they will stop, and then they continue. And I think we are arranging also to make sure that we escort them as they move.
All right. Now, also, I would definitely really want to ask that contact tracing, there was an issue of stigma at the start of this whole entire process.
The stigma is still there.
It is still there. Does it also affect the contacts? Has it also been passed on to the contacts?
So that's why we are putting a lot of effort, first of all, to educate the people that people can fall sick, and this condition can be a disease. You know, we started the same with HIV and TB, the stigma. So we are trying to educate the people that this could be your relative, it could be your cousin, and can fall sick. So the point is, when somebody is sick, it's not a death sentence. The beauty is that even those people we have discharged are now helping us. At least people are able to see that you fall sick, you are treated, and then you are discharged. So we are trying to educate the people, to support the families, to support the neighbors who have the disease, but not to condemn them. Not to look at that family and think, in that family there is a COVID patient, we should throw stones there, we should ban the family, we should close their gates. No, that's not the way.
Do you think, in a way, the stigma that people have around people that have COVID-19 could affect people from boldly saying, you know, I interacted with this person that had COVID-19? Do you think in any way it can affect people from coming forward?
Will. So that's why we have to do a lot of education, a lot of sensitization, because somebody will not come out openly to say, I did, except those who get scared and want help. But the stigma is also working against us, and we are really trying to educate people to address the issue of stigma. Because if people are going to harass you out of your home, people are going to harass even your children from going to a well, from going to fetch firewood, then it becomes a problem to the whole family.
And maybe finally, when I look at our neighbors, we seem to be doing better. And the question among the public is, are we just fortunate, or there's something specific that we're doing better or right at the moment?
I think both are correct. We are fortunate, but I also want to emphasize the point that we were prepared for this. You recall we've been going through 18 months of preparation for Ebola. So for us, when the COVID came, then we triggered the same mechanism, the same structures to respond to the COVID. Where some countries were starting to build these structures, for us, our structures were already in place. So what for us we did was to trigger the structures to respond to COVID. And like, for instance, we had already trained human resource. We already had structures for surveillance. We already had structures for case management. Our staff were already trained to manage such cases. In some countries, if you brought somebody who is COVID or even Ebola, they would run away. But our staff are already trained. They know they'll go into a treatment center, and they'll manage the case. So we already had in place systems and structures, but also we triggered them immediately to start responding. But we also received a very big boost from His Excellency the President. I will not repeat what he did, all of you know it. but the directives he put in place have helped us a lot.
Okay, and also earlier today we saw the Minister of Health, Dr. Jane Ruth Acheng, say that none of the health professionals, at least for those that they've tested, has COVID-19,
Exactly.
is it?
That shows that our team was well trained, because in many countries, like when you look at the Ebola in West Africa, many staff died. But even in COVID, we are getting very many staff, even in developed countries,
Yes.
dying. But our staff are very well trained, especially for infection prevention. They'll go in, they know how to dress, they know what to touch and what not to touch. So they are very well trained. And all the staff we have tested have been negative, because we do serial testing of all our staff.
All right, thank you so much for joining us tonight on Talk of the Nation, and we continue to hope that even the 35 active cases that we have in the country can also recover. So for now, we will wait to see what happens in the next few days and weeks. For you at home, continue to be safe and also follow the guidelines of the Ministry of Health by washing your hands, maintaining a social distance, and also staying at home. Thank you all for joining us on Talk of the Nation.